One of the scariest things about cirrhosis is that it's often called the silent killer because people don't know they're at risk for it, and they don't know the early signs of it. And by the time they actually feel symptoms, it's usually in the later stages. So today, we're going to talk about the 5 stages of liver cirrhosis, so you can be aware of them and also how to reverse these stages and ultimately regenerate your liver. Now, this was originally posted as a blog post. People seem to really like it, but I got a lot of comments saying, please make a video on this. So here it is. Stage 1 is no symptoms or silent. This is where most people are. They have no idea they're even developing cirrhosis. Maybe they had a fatty liver, maybe they had some alcohol use, or some medication use that caused it, but there's no symptoms. You would not know unless you did an ultrasound, liver biopsy, or a certain blood test, which most people aren't going to do. Stage 2 is increased liver enzymes. Now, this could be through a blood test where your doctor checks your ALT or AST levels, and they come back a little bit elevated. So the doctor might find that something is going on with your liver, but again, you would have no symptoms. So a lot of times people just ignore this or think, oh, it's no big deal. But this is where you want to start paying attention. And you should ask your doctor, why are my liver enzymes elevated? What does that mean? And then start making some changes to reverse this. And if you're interested in what those changes are, I put a link down below of the blog post so you can learn more about what you need to do. Stage 3 is the development of what's called F3 or F4 fibrosis. Now, when you look at a liver under a microscope, it has this beautiful hexagonal pattern to it. Between each hexagon is a little road or a pathway that allows nutrients and blood to flow through. When you develop cirrhosis, the liver becomes blocked or cirrhotic. It gets this scar tissue. We call that F3 or F4 fibrosis. You may have no symptoms still, but your liver enzymes may be a little bit higher, or they may be normal. You may notice, though, that you have a lot more pain in your right shoulder area. That's called referred pain from your liver because the nerves from your liver actually get their nerve supply from the same area as your right shoulder. So if you're having pain in your right shoulder, that could be a sign that you have some problems with your liver. Okay, stage 4 is when you start getting jaundice. So you start getting this yellowing of the skin. This could be on the palms of your hands or the whites of your eyes. And sometimes people will have this itchy feeling all over their body. That S because bile is backing up into your bloodstream. And that backs up into your bile ducts, and it starts irritating the skin, causing itchiness. At this point, your liver enzymes are usually very high. And the last stage, stage 5, is the most serious. And this is when you have ascites fluid that's backing up in your abdomen. It's coming from your portal vein because the portal vein is what brings blood from your digestive system to your liver. And so when your liver is cirrhotic, it couldn't really process the blood, and so it backs up into the veins, and the first place it goes is into your abdomen. So you start getting a lot of fluid there. You feel bloated. Your belly sticks out, and usually people are pretty sick at this point. So if you're in stage 1 or stage 2, this is good news. Because if you start making some changes in your diet, you can stop the progression of cirrhosis, and you can start to improve your liver enzymes. And you can ultimately regenerate your liver. If you have any of these symptoms, please see your doctor. Please talk to him about doing a liver biopsy and doing an ultrasound of your liver to determine if you have cirrhosis and what stage you're in. If you're finding this information helpful, please subscribe. Also, I have a free guide. It's called the Top 10 Foods That Regenerate Your Liver, and you can get that by clicking the link down below.